infectious peritonitis, FIP, is a viral disease in cats caused by certain strains of the feline coronavirus. Unlike the SARS or the COVID-19 right now, which mainly circulates in humans, feline coronavirus can only pass from cats to cats. In other words, it cannot be passed from an infected cat to a human. Most strains of feline coronavirus are found in the gastrointestinal tract and do not cause significant disease. These are referred to as the feline enteric coronavirus. Cats infected with feline coronavirus may occasionally experience brief bouts of diarrhea and/or mild upper respiratory signs, from which they recover spontaneously. Feline coronavirus infected cats may usually mount an immune response and produce antibodies against the virus within 10 days of infection. However, the virus may undergo one or more mutations in 10% of the infected cats. With the mutation, the virus can then infect white blood cells and then be spread throughout the cat's body. When this occurs, the virus is referred to as the feline infectious peritonitis virus, FIPV. Pathogenesis. An intense inflammatory reaction occurs around vessels or tissues where the infected cells locate, often in the abdomen, kidney, or brain. Once the cat develops clinical FIP, the disease is usually progressive and almost always fatal without the treatment that has recently become available, but that has yet to be approved to treat FIP in cats by the Food and Drug Administration in the US. There are two types of FIP, the effusive or wet FIP or the dry FIP. For wet FIP, the clinical signs include buildup of fluid in the cat's abdomen, ascites, pleural effusion in the lungs, or pericardial effusion around the heart. Cats with ascites will usually appear pot-bellied, but if the effusion is in the heart or lungs, the cat may not have any outward changes in appearance and only seems to be lethargic or have labored breathing. On the other hand, dry FIP may present a variety of symptoms, many of which are consistent with other conditions as well, which makes for a more challenging diagnosis. Cats with dry FIP often present with lethargy, stunted growth, inappetence, fever, anemia, and/or protruding third eyelids. There is often a history of diarrhea. If the virus has affected the central nervous system or the brain, neurological symptoms may include ataxia, tremors, seizures, or nystagmus, that is, darting eyes.